live in the morning on KTRS.
8:51 here, Big 550 KTRS. Pat Blassie just joining us here. And now we turn our attention to one of the nicest people you'll ever meet, Kelly Jackson. Aww. Her name is Rochelle Hobson, and we met her a couple months ago, I guess, talking about hospice and hospice care. Rochelle Hobson from Celtic Healthcare. Good morning. Thanks for joining us.
Good morning.
Quickly, let's recap, because I was blown away when you told me about hospice, and that a lot of people think hospice is end of life, last few days, just to give sort of drugs to make the dying a little easier. That's not the case at all.
Not the case at all. Like you said, there's so many stereotypes with hospice that, it's call them in at the last minute. We're going to give you drugs. We're going to sedate you. We're going to make you sleep and you're going to die. I've had patients say, okay, I'm ready. And really the truth of the matter is hospice is about quality of life. It's about getting in there, aggressively managing symptoms so that people can actually spend time with their family and do the things that they wouldn't have been able to do had they been in pain, had they still been going back and forth to the hospital and to the doctor. And so really it's about quality of life and really enhancing the time that people have left.
You also said that people graduate out of hospice care, which is amazing.
Yeah. So it's interesting. Since we met, we've had more graduates, and we recently had a lady who her family kept saying, we're not letting her get off of hospice. And we're like, we literally had no reason to keep her on. She was, when we got her initially bedbound, pretty much unresponsive, in kidney failure. And we simplified her medication regimen. We stopped poking her, stopped doing labs. This lady started to slowly wake up, and her kidneys started functioning, and we're like, wait a minute. And several months into this, she's up, walking, eating, doing all these things. And the family's like, well, we want you to stay. But we did graduate her. We put her onto home health with physical therapy to continue to get stronger. So here's someone, as we're heading into the holidays and we think about gifts and miracles, here's someone who was told they wouldn't be here for the holidays, and she's here.
So
that is amazing.
Yeah. All right, Rochelle Hobson of Celtic Healthcare. Now, you're here because holiday season, you're around family members. What are some of the signs? What are some of the things we need to pay attention to?
So, one of the things that we often overlook in our relatives is weight loss. It's something that's simple because everybody thinks it's the holidays. We're wanting to look good as we start to head into a new year. But when you go and you see your loved ones who maybe you've not seen them for a while, you're coming in for the holidays. One of the big triggers that we look at is weight loss, because if they're losing weight, if they've had recent falls, or say they've been in and out of the hospital a lot, and you come in and you look at that, those are red flags that you need to talk to somebody, have them evaluated by a doctor, because those are very big red flags that maybe this person's in trouble and we should consider their options.
Weight loss. Anything else? What about cognitive thought or things like that, forgetting keys or names?
Yeah, so you think about things like, this person's not doing what they would normally do. So say mom is the person who typically is out at the mall and they're doing all the shopping, and all of a sudden they don't want to go out. They don't want to participate in those activities that they used to participate in now. And when that starts to happen, those are big red flags. The other one is maybe they have subtle changes in memory and they're not really recognizing family members. And these are things that sometimes we overlook and we just think they're getting old. I had this happen to me about 2 years ago with my own mom, and she kept losing weight. And then she didn't want to go shopping. I took her to the mall. She said, no, let's go home and let's take a nap. I pushed her, and she was diagnosed with cancer as a result of that. And I think those are the things that we overlook sometimes because we think, oh, she's just tired or she's getting older. In fact, that's what my brother said to me, leave her alone. She's just getting older.
Right.
And I'm like, no, something's wrong. But I think if you don't have a medical background, you may overlook those things. And so I think really the big ones are weight loss, falls, which, it's like, oh, they just tripped getting out of the bed. Well, have they tripped getting out of the bed in the past?
Right.
No. And if not, we need to be aware.
And what about like keeping up, showering and keeping up with their appearance? That's a big thing too, isn't it?
Absolutely. If they're stopping doing those things that would normally be their pattern, that is a red flag. And we have to pay attention to those subtle things.
How's your mom doing now?
She's great. We got her in for treatment for her cancer, and she thanked me, and she said, if I could give you my life, I would, because she's cancer free now.
Oh my goodness.
And that's, had we not paid attention, she could have been metastatic and she could have been one of our patients. And that's sometimes how it happens.
Rochelle Hobson with Celtic Healthcare, you have such a positive image and such a positive message. Sometimes the holiday season comes along. This is the first time the wife, the husband, the mom, the dad aren't around. So a lot of times it's tough out there this time of year.
That is so true. This is a tough time of year because we are looking at traditions and we're looking at rituals. And this is for a lot of our families at Celtic and in every area. This is a time where maybe mom's not there for the first Christmas. This is the time that grandpa was always there and he came in and he helped decorate the Christmas tree, and that's not happening for a lot of families. And so we really try to encourage our families to stay positive and don't change those traditions and rituals. You may have to do things a little bit different. Maybe someone else is stepping up and taking grandpa's place, but we try to encourage our families to not give up the holidays. Continue to celebrate, continue to memorialize. You know, we have instances where maybe you do a candlelight service, or maybe you just light a candle. There's some families that will do a special ornament, and every year that ornament then goes up on the tree. But when it's the first year without your loved one, it's hard.
I got 30 seconds. The doctor does not have to order hospice. You can order it yourself, right?
That is correct. All you have to do is call and ask for a hospice nurse to come out. We can come out and evaluate, and if the patient meets criteria, they can go on to hospice. We will call the doctor and get the order for you.
All I know is I want her as my hospice nurse.
No.
Isn't she the best?
Isn't that the
Isn't
truth?
she just an angel? Rochelle Hobson with Celtic Healthcare. To find out more, CelticHealthcare.com. Rochelle, Merry Christmas. Thanks for coming in.
Thank you.
You got it. I mean, isn't she just...
You are.
Isn't she just an angel?
And look, she's ready to get up.
She's ready to go. She's ready to bail. There you go. All right. She's got to go. Done with you, Millhaven. All right. 8:58.